Hello, everyone. So, welcome to Conversations with Julia Craven. I'm Julia, and today I am chatting with Dr. Uche Blackstock, the founder and CEO of Advancing Health Equity and a emergency medical physician. And we are going to be discussing the coronavirus pandemic and how that intersects with racism and how it has intersected with racism. So, how are you doing today?
I'm doing well. How are you?
I'm good. I'm happy to be here. So that's always lovely. Yeah, so let's get started. So tell us a little bit about yourself, because one thing that I think is very fascinating is that you left academic medicine to come back into direct patient care. So tell our viewers about that.
Yeah, so I'm a second generation physician, which I think is something that I need to mention because especially being a Black woman, there are only about 2.6% of us who are physicians. And my mother was the original Dr. Blackstock, so I always have to make sure that I let people know that. And all the work that I do, especially around health equity, is in her memory. But yeah, I left academic medicine because I wanted to do health equity work. I wanted to explicitly address racism in healthcare. And as you may know, Julia, sometimes these organizations, even healthcare organizations, they are not always the most hospitable
Right.
to, Black faculty and students and trainees. And I couldn't really do the work in the authentic way that I wanted to. And so I left and I started my own organization, Advancing Health Equity, to work with healthcare and related organizations around racism in medicine and racial health inequities.
Gotcha. And so right now, and so all of that is why I spoke with you earlier this year about the pandemic and how it was going to have a really hard hit on Black communities and other communities of color. And so just give us an overview of what we have seen so far. So it's
Right.
been pretty
You know,
bad.
yeah, it's been it's been horrible. It's been basically I call it like a dystopian nightmare. But it was
Hmm.
essentially seen Black communities have been um, disproportionately impacted. When we look at the COVID-19 mortality rates, Black Americans have died at the highest rates. I think the most recent stats are that if Black Americans had died at the same rate as white Americans, 19,500 Black Americans would still be alive. And so that's
Yeah,
a town. That's a town, like a small
right.
town of people. And thinking about all of the families, all of the special occasions that are being missed, all of the relationships. And so what I would say is this pandemic has been, and because it's been allowed, the virus has been allowed to essentially run unabated throughout our communities because of lack of any federal leadership around the pandemic. We've essentially seen Black communities being decimated and devastated by the virus.
Right, absolutely. And so, what does this say about the way racism works in our country, particularly how it intersects with our medical and public health
Mhm.
systems?
Yeah, and what's interesting is that for a long time, I think probably myself and I know other clinicians, we've always thought about health as something just related to the healthcare that's available, right? If you have access to healthcare,
Hmm.
then you're healthy, right? But I think what this moment has really brought into clarity about is the fact that we know that like structural racism is a key driving force of what we know as the social determinants of health. That if you have jobs that are putting you on the front lines or
Hmm.
as essential workers, you're going to be exposed to coronavirus. If you are living in overcrowded housing, right, which is more likely to occur in our communities because of lack of affordable housing, lack of opportunities for home ownership, then you're going to be
Hmm.
in environments where you're more likely to be infected. Even thinking about who is using public transportation and who is less likely to be able to afford a car or car payment, right? We're looking at our communities. And what systemic racism has done is essentially limited the opportunities that Black Americans have had to the effect that it's placed us in a situation where we are uh, most vulnerable to being infected with this virus. And then add on to that the fact that our communities carry the highest burden of chronic disease, which again is a result of racism, lack of access to care,
Right.
lack of quality care, lack of investment in our communities, lack of opportunities for, finding healthy food options in our neighborhood. So all of what we're seeing right now just shows how deeply embedded racism is in this country, in every aspect of the lives that we lead.
Right. Absolutely. And so what happens when you compound that with stress?
Yeah, and so we also know that the chronic stress of living in areas where there has been this chronic disinvestment
Hmm.
that increases your stress response, that increases cortisol levels. We also know that influences gene expression. So we know that some of the high rates of diabetes, autoimmune diseases that we see among Black Americans is due to this idea of epigenetics, the fact that the stress of racism can change which genes are turned on and off. So all of those factors combined have left Black communities essentially sick.
Right. And so this has me I saw a story a couple weeks ago, or actually I think it was a while ago about how the testing sites for coronavirus in Chicago, I believe it was, they lined up with the redlining maps basically. So neighborhoods that had been redlined didn't have as many testing sites as other neighborhoods did. And so I just would love to get your response on that because it's like you said, it's so embedded down to the fact where you just don't even see as many testing sites in
Right.
poor neighborhoods.
Right. And so what's interesting is that I actually just gave a training to a pharmaceutical company and we talked about redlining because I wanted them
Hmm.
to understand what the patients that they were treating, what they were experiencing. And what we're seeing today is a result of social and economic policies from decades ago, that when you don't have investment in communities, when people don't have jobs, people don't have anywhere to live, when they don't have healthcare institutions in their communities, what we see are, people are sick. We see higher chronic disease burdens. And so I think that it's important to understand racism, how it behaves on a broader structural level, because I think a lot of people
Hmm.
think about it as just as interpersonal, someone calling someone a racist slur, someone harming someone because
Yeah.
they're of a different race, right? But what we see what racism is and how it has impacted Black Americans to such a high degree is that racism it's structural. It's in our social and economic policies, right? So when you have redlining,
Right.
where that has left to profound poverty in our neighborhoods due to lack of ownership, home ownership, property taxes going towards education. I mean, those are just compounding factors that have left our communities sick. And they even talk about the New Deal, the creation of the Federal Housing Authority, the GI Bill, and all of these were social and economic policies that have essentially disadvantaged Black Americans and led to the disparate racial wealth gap that we know influences health. And so when we talk about what do we do now, what we do now in order to reverse what we're seeing, it is going to be about social and economic policies, right? It's going to be about thinking more broadly about structural solutions versus, what I do as a physician, right? The interpersonal interaction I have with my
Right.
patients.
Right. And so, why is an anti racist framework important in medicine, whether it be structurally or in your interpersonal reactions?
Yeah, no, it's so interesting because,
Interactions, sorry.
yeah, no, that's okay. Yeah, no, we actually have been having a lot of discourse among medicine Twitter, like among physicians, about whether or not social justice and systemic racism is something that we should learn within our education and training, right? But how can
Hmm.
you adequately care for your patient on an interpersonal level, and how can institutions adequately and equitably care for communities if we don't understand the broader structural forces that are influencing their health? And what's going to turn out to be is that no matter what I do, what medications I prescribe, what counseling I give, if there are underlying socioeconomic factors like poverty, inequality, lack of education, whatever I do is not going to make a difference. right? And so that's why I think
Right.
this is a call to action for healthcare institutions to really be thoughtful and more transformative in thinking about how are we educating and training not just physicians, nurses, physician assistants, anyone that is interacting with patients. How do we give them a framework for understanding what especially Black patients and communities have gone through in this country for
Mhm.
centuries?
Right, absolutely. And so that now that has my gears turning about Black medical schools and how the historically Black medical schools they have closed. And so how do you think this would have abated the death rates that we're seeing with coronavirus?
Right. Yeah, and you probably saw that piece that was written recently. It was a research piece that showed
Yeah.
that if so, there was the Flexner report, which was in the early 1900s, and essentially this person, it was an educational specialist named Flexner. He was commissioned by Carnegie Mellon Foundation and American Medical Association to look at medical education, and essentially came up with these very rigorous medical standards that didn't necessarily correlate with better education or training, but what led to the closing of a number of the majority of Black medical schools, of HBCU medical schools. And so what we saw from even that study alone is that between 20 and 30,000 physicians, probably mostly Black physicians, would have been trained or in the workforce if those schools had remained open. And what we do know from
Wow.
another study that came out last week on infant mortality, I don't know if you saw that one, about
I
Black
did.
babies, right? The Black babies were more likely to be cared for by Black physicians at birth. Their infant mortality rate was decreased significantly compared to if they were cared for by white doctors. And so while we know that having more Black physicians is not going to end healthcare inequities, it is one significant factor to addressing them. And so I think that when we talk about reparations and we talk about what needs to be done now, I think to have Black medical schools where we are focusing on educating Black healthcare professionals would be key.
Right. That I don't know if you saw this piece, but there was I believe it was in the Times about the ER physician who was like, I am the only doctor in my hospital or in my ER ward who stands up to the police. I'm the only one
Yeah.
who will intercept this this very traumatic, stressful interaction for people who are in the ER for traumatic, stressful reasons.
Yeah.
And that just made me think about like how vital it is to have Black doctors in place because I just know from my own experience, like if it weren't for Black doctors, I mean, who knows? Who knows? Truthfully.
Right. No, exactly. And I will say the writer of that piece actually is my friend from college. So it's such a small world. She's my fellow ER physician, but also my friend from college. And we definitely have had similar experiences because we both trained here in New York City in emergency medicine.
Mhm.
But no, but I do think that, and I'm even thinking about the last few months through the pandemic. I even had a patient, a young Black woman who I was wearing all of the personal protective equipment, but she came in and she said, I just want to make sure you're Black because I want to make sure that I feel listened to. And I said, yes, I am here. I will listen to you. And I realized, and I know because I've been on both sides of it, as a physician, but also as a patient, that it's so important to feel seen, heard, and valued by the person that is caring for you. Like, I also think being a patient, that's like the most vulnerable that you can be as a human being, to put your care, your help into the hands of this complete stranger. And I mean, and the fact is that we have a lot of data and we have a lot of literature that shows that, most clinicians, even regardless of their race, have a preference for white patients over Black patients. And we've seen that manifest in terms of who gets pain medication and who doesn't. We've seen that implicated as a factor in Black maternal mortality crisis. We see it with the infant
Right.
mortality data. And so, I think part of it is definitely we have to think about training a workforce that is competent in providing care to Black patients. Part of that is having more Black physicians, but also part of it is having training other healthcare professionals who may not be Black in taking care of Black patients, which is
Right.
crazy. But that just shows you how deeply embedded racism is, right? And that when you, and
Right.
because we live in a racist society, just because you go into a hospital, right, to work doesn't necessarily mean that all of the cultural associations and messaging that you got when you're outside of those four walls cease to exist.
Right. Yeah. And so another thing that I wanted to get into are the mental health effects of the pandemic on communities of color. So I also saw the study from the CDC saying
Mm-hmm.
that um, the respondents were reporting there were an increased rate in respondents saying that they were suffering from depression and anxiety and also having suicidal ideation, and that increase was higher amongst community people of color. And so I wanted to talk to you about that because it is a very stressful time right now, and I don't know if I know anyone who isn't struggling in some way with what's happening. And so when we consider all of that and then we start talking about a community that already has limited access to mental health care options, what can we, well, I don't want to say what can we expect to see, but just what are we looking at here?
Yeah, no, I think that again, showing how um, racism, right, is not just affecting physical health, right? So we're thinking about we're in this pandemic and we're seeing Black people being infected, hospitalizing, and dying from this virus, right? But of course, no, it's not
Right.
just that because we know how insidious racism is. We know that this, as you mentioned, this is a stressful time for everybody. But here, we as Black people have to deal with um, our fellow Black citizens being killed by the police, right? So that stress, the stress of everyday racism. And then, our communities have suffered actually the more significant economic and job loss, right, than other in terms of small
Right.
businesses, in terms of jobs, right? And so all of those factors are making this already, this crisis, even more of a crisis for us in particular. And then add that on to the fact that in our communities, we don't have we have we're under and uninsured, and we don't have access to mental health professionals. And so again, I think we're going to see this is like not like what they call it, the second wave in essence, second wave of of mental health issues. Like first we're thinking physical issues in terms of the virus, but then thinking about the long-term effects of what this will do in terms of mental health of our communities. It's just, yeah. So that's why I think any like local and state efforts that are going to address racial health inequities, it's not just going to be about increasing testing availability. Right? It's not going to just be about making sure that the healthcare institutions in our communities are more well resourced, but it's going to be about making sure people have housing and like financial assistance, and also whether or not they have access to mental health services, right? So it's going to have
Right.
to be a multi-pronged approach.
Right. And it's very frustrating that people don't have access to these very basic needs, or at least what a lot of people see as being basic needs.
Yeah, and that's why however horrible and depressing this moment is, I also think it's a moment to think about like transformative structural change and thinking about how,
Hmm.
just from a healthcare perspective, how we can provide better care to people. So obviously, I'm all for universal health coverage, single payer. So that's something that I think that we've seen even across the world. Those countries have done better when people have health insurance, they do better. I mean, it's like
Right.
no brainer, right? But also thinking about how our healthcare institutions function, and ensuring that they're engaged with the communities that they're serving, that they're working with community-based organizations on the ground who are already trusted individuals, trusted leaders in the community, but also thinking about not just patient care, but how can we liaise with these organizations and make sure the patients that we're discharging home have just been admitted for with COVID-19 have somewhere to stay, right? Have financial
Right.
assistance, that we are making sure that they do have healthcare insurance, right? And so these are ways that healthcare institutions can start thinking a little bit more progressively and confidently about how do you care for patients in this, in these communities, because it can't just be about here is a prescription, right? It's like here's a prescription for housing, right? Here's a prescription for
Right.
financial assistance, right? It needs to be what we call structurally competent care.
Absolutely. And so speaking of sending people home from the hospital, there was a story. I can never remember where I read this stuff because I'm just reading so much stuff, but there was a piece, I think it was in Boston um, Medical News or something. But anyway,
Mm-hmm.
it was about oximeters
Oh.
and how they don't give accurate reads on melanated skin. And so I was wondering if that is something that people should be concerned about, considering that pulse oximeters are and your blood oxygen levels play such a big role in coronavirus treatment.
Yeah, no, absolutely. And I saw that piece and obviously was very disturbed by it. But of course, it made sense to me that that would happen because often we are not enrolled in trials, in clinical trials, or in testing of medical devices, right? So there is that whole other issue
Hmm.
with recruiting us for that, right? And so of course you have bias
Right.
in and bias out. So, but I think that again, with the education and messaging to our communities, because what we're seeing with the
Hmm.
pulse ox is that patients' oxygen levels will actually drop before they start having symptoms, right? And so we really want
Right.
them to be able to monitor that. And so I would say that, be extra vigilant, if you're having any symptoms, making sure that you're going to seek care, even if it's just to go to a urgent care like my clinic. I tell my patients, come back,
Hmm.
even if it's just to get your oxygen checked, right? Because we can also do other testing for you to see how you're doing. But again, this just shows how deeply embedded racism is. The fact that this pulse ox, no one's saying the pulse ox is racist. What we're saying is
Right.
that the people who went into developing the pulse ox were not thinking about or considering testing it on people with different skin tones, right? And so we see this
Right.
all the time with different algorithms, right? And so this is also a way how technology itself can be embedded with
Hmm.
bias, right? That can be harmful to our patients.
Right. Absolutely. And it's very interesting how all of these inequities are intersecting with one another right now. And it just kind of feels like I always describe it as it feels like we're crawling through cement. That's kind of how it feels like when
I
I
know.
see the increasing mortality rates for Black people and coronavirus, and then I
I
see
know.
the news of another police shooting, and it just feels very cyclical and cruel.
No, absolutely. I feel the same way. It's like how much suffering can our communities take? And we're getting it from all different
Right.
angles, right? We're getting it from a virus, not to blame the virus, but we're blaming the lack of effective leadership that has deprioritized our communities, right? Because our
Right.
communities obviously are not important enough for you to actually put preventive measures in place to prevent this, right? Because the virus can
Exactly.
only spread with our help, and it can be contained by our help.
Hmm.
So, essentially getting it from all different angles, and yeah, I'm trying to be positive. I think part of doing this work and
Yeah.
amplifying the racial health inequities is something that I have found empowering, and then also working with healthcare organizations to think differently about how they're delivering care so that our patients can get the best care possible.
Right. Absolutely. And so, just to kind of go off of that, I wanted to ask you about the election and coronavirus. And of course, that's a big question because there's a lot of moving parts there. But particularly, one narrative that we've seen popping up online is that a an administration change could dramatically shift the response that we're seeing or the government response to the pandemic. And so I wanted to get your thoughts on that.
Right. And so I think that my perspective on that is I'm just trying to be realistic, because the fact is that we had racial health inequities when during prior administrations, right? And we had the killing of Black
Right.
Americans during prior administrations, right? And so I don't
Right.
know if we're going to see, um, you know, radical enough change to see any change on that level. So, and I think also what we've already seen profound amount of death from this virus.
Right.
And so, while I think, and as a result of not investing in our public health structure, right? Not investing in our
Right.
healthcare institutions, right? And that has been
Right.
over decades, right? That's been going on for a very long time.
Exactly.
So, and so while I do think that if we have a change in administration, that there will be, of course, improved testing availability and a prioritization of like wearing masks, right, which has been so politicized,
Right.
right, and an emphasis on these preventive measures, and more effective leadership, hopefully. That we've already seen so much damage and destruction, and I think it's going to take a while for us to see any real improvement.
Yeah. Well, thank you for that. And thank you for offering that perspective. That is not necessarily the perspective that we've really seen. So thank you so much for that. And I also wanted to ask you about sending your kids back to school because that's also a big one. And it came up a little bit earlier,
Yeah.
particularly like for Black Americans, for Latinx Americans, for people who have essential jobs. Like this is a big, and then daycare is apparently very expensive. I don't have kids, so I don't know how
No.
expensive it
Yeah.
is, but I believe parents when they say it costs too much.
Yeah, I mean, I think the whole issue of sending children back to school, especially our children, is like almost a false choice, right? I mean, the fact is that schools have
Hmm.
been essentially become a safety net for our children, right? I'm in New York City with 1.1 million children in the public school system, including my own children, and most of them are Black and Latinx, right? And so the kids,
Right.
they don't just go to school for education, but they go for healthcare. We have hundreds of healthcare clinics in schools. They go for special education services. And so we know that our children not being in school is going to have profound effects and worsen those educational gaps. But we also know that our communities are also the communities that have been most disproportionately impacted by coronavirus. And the schools may not have the
Right.
resources to going back to school safe. And so I essentially feel it's like almost it's a false choice, right? It's almost like you're weighing the risks and benefits. And I think ultimately for many families, it will be deeply personal depending on what their priorities and needs are. But again, showing how deeply embedded racism is in all aspects of our society, including our educational system.
Yeah. Which is, yeah. I remember seeing early on how a lot of folks were concerned about kids being able to eat because at school, that's
Right.
often the only place some kids can get food. And I know that in DC, at least a couple of the schools, they were just like, hey, the kids can come here and get their food. Like they can still come and they can still eat.
Yeah.
So it's also been interesting to kind of see how our social systems have really shifted to meet
Hmm.
this moment.
Right.
And some of those systems weren't meeting the moment before. And
Right.
so I would love to get your thoughts on that if you have any, because like, for example, evictions. It was very clear that once the pandemic kicked in that we don't have to evict people.
Right.
So,
Yeah, no, I mean, I think that this is opportunity for us to think about transformational change, right? In all aspects of how we do things. So, like as I mentioned, even with how we take care of patients, right, and thinking about it as
mhm,
beyond the interpersonal and more structural, but also exactly showing how here in New York City we evolved to make sure that we provided meals to all the children that were missing them in school. So again, I do think that even though
right,
this is an unprecedented time, there's been a significant amount of human suffering. This also is an opportunity for us to think and move forward and thinking about how can we create structural and sustainable change that will help support our communities.
right, absolutely. And so, I feel like that's it. I think those are all of
Okay.
the questions that I have for you. But if there is anything that you would like to add that you feel like or that I didn't ask about, please do share those thoughts with us.
No, I just think that sort of in moving forward, just because just thinking about the racial health inequities in the pandemic, I think what we're going to see is a lot of
Hmm.
mutual aid and mutual aid organizations that are going to be picking up the work that the federal government and state and local governments should be doing. So I would encourage people to reach out to community-based organizations in their own areas and see what kind of work that they're doing in terms of supporting our communities around this pandemic.
All right. Well, thank you so much for your time today. I really, really appreciate it. I'm so glad that we were able to get you on the show. And to everyone watching at home, thanks for, watching this season, I guess. And yeah, this has been great. Thank you again. And to the folks at home, I hope y'all are drinking water and wearing your face mask and sunscreen.
Yes, I have my water.
Yes, I have. Well, this is not water, but whatever. I drink a lot
It's
of water.
liquid.
I try. All right, everybody. Thank you so much.